I am here with Marcela Sicora, a citizen from São Bernardo, São Paulo, to discuss about the health system in Brazil. In a list of 48 countries, Brazil takes the last place in the health system ranking. In a country that populates millions of people, this ranking does not look good. The population demands better health services. The city halls complain about the lack of investments in medical doctors in the cities, and the doctors ask for more adequate work conditions. The difference between public and private health is unquestionable. Those who depend on the public health don't have the same privileges of those who are able to afford the health insurance.
I feel like health in Brazil has, two sides, public and private, where middle class and high class are able to pay for, fairly expensive health insurances, and they get to use a fairly advanced and good health system, while poor classes don't have the money to pay for insurance, so they do have to face very, very long hospital lines and waiting line to get transplants, to get appointments, and it's a very sad situation.
The quality of the health services is mainly influenced by the dissatisfaction of those doctors who work for the public system. The salary of these professionals is about half of the salary of a doctor that works in the private system. Besides, doctors that work in the private hospitals have access to the most technological equipment and better work conditions. This doesn't happen in the public hospitals. The infrastructure of many public establishments is scarce. The government invests very little on them. Public hospitals don't carry all the equipment needed. Doctors are not satisfied with their work conditions, and the number of patients is higher than the number of rooms and doctors available.
Since the health insurance in Brazil is not affordable for the lower class, that has a huge impact on society because most of our population is in the lower class. There are so many sad cases that people are unfortunately dying, waiting to see a doctor, and they don't have the opportunity to.
The government came up with a project called More Doctors, where they are bringing foreign professionals to work in the remote areas. These doctors will have a salary of 10,000 reais, equivalent to almost $5,000. And each city that shelters them will be responsible for providing food and a place to live. This project has created many controversies.
I personally don't agree with that because I feel like she should invest in our people and in our doctors instead of just bringing doctors from other countries. I feel like there's a lot of problems with that, starting with the language barrier and with the amount of unemployment we have in the country. I would love if Brazilian doctors could work on those places.